Welcome to the Social Workers radio talk show on WCDB Albany 90.9 FM with co-hosts Dr. Eric Hardiman and Alyssa Lotmore. Here at the Social Workers, we address issues important to our communities with social work students, alumni, and community partners as our guests.
As part of the University at Albany School of Social Welfare, we hope to take social work beyond the classroom and agency settings and directly to the public, because the public is the client. Catch us on air, online, and anytime.
Welcome to WCDB Albany. My name is Eric Hardiman. I'm here with Alyssa Lotmore, and we are the Social Workers. This is the Social Workers radio talk show and associated podcast. And let's tell the folks what we do here, Alyssa. What do we do here at the Social Workers? I'll let you talk about it a bit.
Oh, you gave me the hard question. No, it's not hard because it's really exciting. So we have been around for, oh my gosh, what is it now? 12 years?
I think so, yeah.
And it's really a way for social workers, for us to be able to be the media and engage the media and to reach individuals who might not have ever considered seeing or using a social worker. So it's really getting on and talking about social work related topics and reaching an audience who might not be familiar with those topics.
Yeah.
But this year it's a little bit different because we're kind of expanding social work to include some aspects of public health. And there is a reason for that. Because social welfare is now under the College of Integrated Health Sciences, which encompasses the former School of Public Health at the University at Albany and their nursing program, as well as the School of Social Welfare.
Right. So just as things are changing nationally and internationally, as we know, there's also a lot of local change. And so one of the big local changes here at the University at Albany is this newly merged center, college, if you will, the College of Integrated Health and Sciences. And so it's an interesting time to be talking about that. And so we have as our guest today, Alyssa, you can do the introductions, but we have the leaders of the new college. So yeah.
So our interview today will feature Erin Bell, who is a professor of epidemiology, biostatistics, and environmental health, and she is the new dean of the College of Integrated Health Sciences. And we also have Victoria Rizzo, who is the senior vice dean of the College of Integrated Health Sciences, and also the professor and director of the School of Social Welfare. So with that, let's jump right in because they can explain this whole new college much better than we can. Let's jump into our interview with Erin and Vicki.
Let's go to the conversation now.
All right. Welcome, Erin and Vicki, to the Social Workers. I'm so glad that you can come on and talk about the new College of Integrated Health Sciences.
Yeah.
So we're just going to jump right in and tell us a little bit about the reasoning behind this new college.
So thank you for having us here today, Alyssa and Eric. It's always a pleasure to speak with both of you. The reasoning is really due to the fact that we learned during the pandemic that we really have to have a team approach to health and wellness in our communities, both for our individuals in the communities as well as our full population. And so we need the opportunity to have our bench scientists and our social scientists and our policy experts, along with our clinical practitioners, our social workers, and our nurses, to have training together so they learn each other's vocabulary, but to also learn how their work complements the work of their co-worker together and have that full team approach to the efforts that we put in to improve health and wellness for everybody.
Go ahead, Vicki.
I would just like to add that I think having these disciplines in a college really strategically places us to deal with like the social determinants of health. We can engage in community collaboration and advocacy and conduct high impact research, because the social issues that we're dealing with today cannot be solved by one discipline. They require, as Erin said, everything from the bench science to the clinical practice and everything in between.
And so the university has really, in this merger, has taken two separate colleges, what were formerly two separate schools, apologies, and merged into one college. Do you see this as part of a larger trend nationally at other universities, or how does this fit into the bigger picture of higher education?
Yeah, I've been really pleased and excited at the response we've received nationally from our other schools of public health and schools of social welfare. Several colleges have taken this approach, but I'm probably more often than not, the response I get, oh, I wish we would do that. And at our professional meetings around public health, our response to the pandemic, and when I've presented my own research, again, I have colleagues coming up, and I know Vicky has as well, with her social work meetings, that people are very excited with this trend. The belief is this is where we need to go
Mm.
professionally in all that we do.
I think the other piece that's interesting is when I talk to our community partners and um, people who have been on the social work advisory board who are practicing either at the association level or the nonprofit level. They think that they always respond, wow, this is terrific because this is where the field is moving. Like, this is where healthcare is moving. This is where not for profits and community um, engaged organizations are moving because they also have the realization that these problems are too big to solve within one profession.
Right. And to that, as an example, I had a community meeting earlier this week with some of my community partners for some of our own research on environmental exposures. And they were asking a lot of questions about the new college, and they're very excited to meet and and get to know the social welfare faculty and students because they've identified as a community where they really need the support from the social welfare side to work in conjunction with the environmental justice and the environmental exposure experts to really move forward the health plans and wellness initiatives in the community.
And even though before we were two separate schools, there was still a collaboration from our faculty, our staff, our researchers. So this is just helping to have this all more of a formal ways and sort of look for more opportunities to engage in collaboration as well.
That's right. We already had an MSW and PH combined degree. We had a number of faculty conducting research together on joint projects. We have a natural connection with our health policy work for our social welfare colleagues. And we have a very vibrant maternal and child health program within the public health departments. And this is a clear area of expertise in social welfare. So I think all of those, along with aging and healthy aging, we have a tremendous opportunity to grow. And we're very excited about growing opportunities at the undergraduate level. Again, there's a lot of interest in with our undergraduate students for both public health and social welfare and social justice. And so this is really just a natural fit.
And so if there are prospective students who are looking at degrees in either social work or in public health separately, and they don't necessarily understand some or know about these sort of integrated ideas and ideas about integrating and merging, what would you say that that prospective students would need to know about this new college?
Well, I think we have a couple of unique um, foundational approaches that we have here. First, the School of Public Health, before it became part of the college, was actually created 40 years ago in partnership with the New York State Department of Health. We're the only College of Public Health with such a close partnership with a state level health department. And many of our faculty are actually researchers and policy experts at the health department. And they help mentor particularly our doctoral students, but they also provide a rich opportunity for our master's and undergraduate students in experiential learning. And we are in the process of expanding that partnership to include social welfare and nursing to broaden our opportunities for all of our students. And so there's a great opportunity for those prospective students and our enrolled students to engage at that level, at both the state level as well as our county level with public health and preventative health. So that's one thing. And then the school social welfare is 60 years old, as you all know. So we're 100 together, is what we always talk about. And the MSW was just approved, and we have a new structure for that. Not just approved, but it has been revised. And I don't, Vicky, do you want to speak to that and the benefits of that?
Sure. I think first I want to go back to the first thing that you
Okay.
talked about with the Department of Health. So I think an advantage of that is certainly expanding that MOU to include social welfare and nursing, because, we certainly as a school have really wanted to have more internship opportunities, more research opportunities between faculty and students and the Department of Health. So I think that is going to be a real bonus. And then our school has very close relationships with the Office of Mental Health and the Office of Children and Family Services, and also the Office for Aging, so that I think that we can bring some of that knowledge to the college, so that I think together we are dealing with many state agencies that all need our expertise. And so I think that presents a really exceptional opportunity for us to expand the work that we do in the college. So
And
in regards to yes, we do have a new MSW curriculum that we are going to launch in the fall of 2025. It's being launched because when we had our last self-study for the Council on Social Work Education for our reaffirmation, which is another word for reaccreditation, we had focus groups with our partners in the community and with faculty and with students, and they identified key areas where they thought that we needed to improve our curriculum. So we have been a curriculum that has two tracks: direct practice and macro practice. And what has become really clear is in social work, it's not an either or, it's an and both. If you're a social worker, it's very rare that you are just doing direct clinical practice or macro practice. If you are serving your client, the community, a group, you have to do both. You have to understand how to work with an individual and a family, but you also need to understand the policies that are impacting the families, and also work on the advocacy level, work on program development level. So our new curriculum is an advanced generalist practice curriculum that actually incorporates macro and micro together. And so our new foundation courses will actually be combining all aspects of social work practice, focusing on the different areas. So the first course will be on engagement. We'll have a course on assessment, and then treatment, and then evaluation across all of the populations that we work with: individuals, families, groups, organizations, and then the larger, macro setting. So I think that this is really going to prepare our students for practice in a very rapidly changing environment that we are living in, both nationally and globally. The other thing that I think is very exciting about this is right now our MSW MPH program is only in one department in public health. And the expansion of our curriculum, I think, is going to allow us, and Erin, you could probably speak to which other departments you think that this would fit, but I think it allows us to really expand that dual degree.
Absolutely. So right now, our MSW MPH really focuses around health policy, but we also have opportunities with social behavior, social determinants of health, and understanding interventions and the implementation and what is most effective with improving health. But there's also ample opportunity around epidemiology and biostatistics for those students who might be particularly interested in how to research risk factors or the impact that social determinants has on health outcomes and well-being, and then use that information to draw on how to effectively mitigate those impacts in when they're working with clients or at the community level. And so really they work hand in hand together. So we have a number of opportunities to do that work.
now, outside of the MSW MPH and the new curriculum that's coming for social welfare, are students, now that we are all under the College of Integrated Health Sciences, could a public health student or take a course in social welfare or vice versa?
Yes, and we're very excited about that. There are a number of courses that we think speak to both of our student populations, are very, of interest to them, and this will broaden and create an opportunity for us to really expand opportunities for our students to take electives and to learn from one another, and that's very exciting.
And it's
It's
also probably
really
exciting for them when they graduate and going into the career. You said there's so many relationships with the Department of Health and these New York State agencies to have a background in somewhat social welfare and public health, being able to go into the field is really attractive, I assume.
yes, and I think that, certainly what we find in the school, and I know Erin and I have talked about this, and it's similar in um public health, is we can never offer as many electives as we would like to offer, which because of enrollment numbers, et cetera. But then there are also some courses that public health offers that we don't, and that we offer that they don't. For example, we have an elective in environmental justice,
Mhm.
which they do not have. They have courses in health disparities and social and behavioral health that our students may want to take, or they may want to take a course in public health because they're interested in it and they want to take it as an elective to see how that impacts their work with on the various levels in society. I also think it presents really exciting opportunities for doctoral students. The School of Public Health doesn't have a qualitative research course. We do. Actually, Eric teaches it. So I think that we can also, I think having these more expansive courses is good for our students, but I think the other really exciting thing is that they will sit in the classroom with each other, and so that they can learn to speak each other's language. I can remember when I was in my doctoral program, I was encouraged to take public health courses because my mentor said, if you're going to work in this field, if you're going to work in this healthcare field, you need to understand the language of the other disciplines that are in it. And so if our students are sitting in classrooms together and trying to tackle problems and figure out how to do qualitative research or even quantitative research, I think that it's going to set them apart from other graduates.
Right. And we haven't even talked about nursing yet. So
Yes.
we have a fully online Master's of Population Health Nursing. I was actually just in a meeting right before this podcast to discuss opportunities for students to, again, work with one another and learn each other's vocabulary. We are setting up a simulation lab for our nursing students, but really want to lean into the fact we are now an integrated college and have expanded simulation opportunities around poverty, for example, or bedside teamwork when you have a social worker and a nurse working together with the same client, and disaster planning. Right, we are public health. We have pandemics. We have disasters. We have to respond to, and so there will be ample opportunity for our students to work with one another in addition to these opportunities to take electives with one another.
I mean, that is another great strength of this college, is that it provides opportunities for interprofessional education. And, certainly Erin and I have already been talking with the nursing director because, they have a requirement for interprofessional um, educational opportunities, and so does public health, I think. So that and social work doesn't, but there are so many ways we can design activities that will allow our students to tackle problems like poverty, to work at the bedside, to incorporate them in our classes so that it's not extra work. It's not extra things that students are doing, but that they're doing it as a normal part of their study.
So I'm
But this,
curious, I wanted to ask a sort of bigger picture question, which relates to some of the news in the past week. And, thinking about challenges that are going to be facing the new college and also the university in the next coming years. And so I'm wondering, if the two of you could talk a bit about what you see as some of those challenges as they relate to our two disciplines and to the integrated college.
So I think the immediate challenge we're all facing now is that whenever there's a period of transition, regardless of what that transition is, there's always uncertainty and trying to do our best to prepare for it. In discussions with our other national deans for public health and social welfare, we've really focused on the fact there are a number of policies and issues that are near and dear to our professions that cross all lines. It doesn't belong to a single political party. So we are able to lean into that and will continue to lean into that as we do our work. We will continue to do the work that we do. We might have to explain it more. We might have to, and I think what we've learned over the last 2 weeks is that we have to do a better job of communicating what we actually do. People don't necessarily understand, and what we are focused on it with regards to improving health and wellness across all of our communities and all of our people. And so this will give us opportunities for that. People will continue to need support from our professions. One thing that all three of our professions have in common, we are all in our jobs because we are driven to it. We have a passion for it. We are committed to the health and wellness for everyone, and we'll continue to do that work. We might have changes in how things are funded, or we might have changes on particular emphasis of what will be an initiative at the federal level, but that happens with every transition. And we know how to do that. That's not new. What we do have to pay attention to now, and we're particularly focused on, is to make sure our faculty, students, and staff who identify with groups that might feel a little unnerved right now and certainly are hurting, is to make sure they have the support they need to do their work and to continue to thrive professionally and personally. And we're focused on that as a school, but we're also very focused on moving forward with our mission. We're not going to stray from that. We're going to continue to do our work and move forward.
I mean, I agree with everything that Erin has said. I think we will move forward. We will be challenged, but we will do everything that we have committed our careers to doing. And, I can say that I think all of the faculty and staff in this college are very committed to that. And it's our job to support faculty and staff and students in the work that they want to do to serve the communities that need us the most. And this will be challenging, but I have total faith that we will do the good fight and continue to serve our communities. We will figure out how to do it. And we do this with, the full support of the university president, the chancellor, the provost. They are as committed to the missions of social justice and social equity and helping people, rise through college education and social mobility. So I think that we are in a great institution that will support the work that we're doing.
Now, one of the things, and it might be a little confusing to people, but public health is no longer the School of Public Health. They are now under the College of Integrated Health Sciences, as is social welfare, but social welfare is still a school within that college. We are still the School of Social Welfare. So with that, the School of Social Welfare is celebrating its 60th anniversary in 2025. And Vicki, I'd just like to talk to you a little bit about what there's been so many accomplishments of the school. What are some things that you're looking forward to now that we're in the 60th anniversary year?
So I'm really looking forward to, we're going to have our celebration on April 3rd. And, the School of Public Health has their David Axelrod Prize to celebrate their 40th anniversary on April 2nd. And certainly alumni and students and faculty of both schools are invited to both events. What's exciting right now is I see this 60th anniversary as like a real sea change in our school, and not just talking about the new college, but faculty and staff and students and our agencies have worked so hard on this new curriculum that I really think is cutting edge, is going to help us stand apart from other schools of social welfare. Also very excited about our online MSW program that, we were supposed to admit 15 students into that program this year. We ended up admitting 24. We're going to grow the program next year. And this program is really designed to target students who are not traditional and who live in rural areas where there isn't access to in-person MSW programs, and also to working individuals. I mean, the program is unique in that other than the field practicum component where students have to be in their field agency. It's entirely asynchronous online, which like really provides the greatest amount of flexibility for people to earn their MSW. The other really exciting piece is our social justice minor, which, you know, the provost asked the School of Social Welfare to develop a social justice minor and major. We've started with the minor. It really was developed because of undergraduate student demand. What's really great about this minor is it provides students with the opportunity to understand social justice. There are several courses that they take in the school of social welfare, but it's interdisciplinary. So there are courses that they can take in public health. There are courses that they can take at the Rockefeller College, the School of Education, the College of Arts and Sciences, so that it provides students with what is social justice from all these perspectives. And it is really important as we want to be able to have civil discourse, and having an understanding of what social justice and health equity are is really important. And having this as a minor can help students figure out what do I want my major to be? And there's so many opportunities that are related to social justice. And then if I decide to go on to graduate school, what might that look like? So with a social justice minor, and we are now in the midst of creating a major, which will hopefully have different tracks connected to different disciplines. They can really think about, like, with this knowledge, social justice major could get a degree in social work. They could go on to get a degree in education. They could go on to be in the College of Emergency Preparedness, cybersecurity, etc. And I think that it's a very versatile degree. The other very exciting thing is it will be the first interdisciplinary university degree. It's housed in the School of Social Welfare, but it's not owned by the School of Social Welfare. It's owned by the university, with us leading the charge that we were given. So those are things that I'm really excited about. I also think that you know, we have great opportunity. We have new faculty who are doing very exciting research in the LGBTQ community with at youth risk, using photo voice and documentaries. And so I think that there's great, I see this like as, I don't want to say a rebirth, because we've been around for 60 years and we've done lots of good things over those 60 years, but it's entering a new phase.
Well, this is definitely an exciting time. And as we wrap up, I want to just look forward into our alums as well. So, with public
Right.
health and social welfare joining together, there's now this expanded group of alumni. And will there be ways, you mentioned the 60th anniversary celebration for social welfare and the Axelrod Prize, both in April, but what are some other ways that we are going to engage and celebrate our accomplishments and sort of include our alumni? I mean, I know there's things like the upcoming magazine that's going to be coming out, the Joint magazine, but what are some ways that you're excited to engage our alums?
Well, I think, and we're very excited about our magazine. So,
Yes.
and we're gonna, we had a meeting this morning, and we'll feature some of the work our alumni are doing. We're very excited. Our students are so excited. It's been fun. Vicki and I have been on a dinner with the deans tour this semester, and we've been meeting with our students and learning from them. And we're excited to have that similar level of engagement with our alumni. So we hope to reach out certainly at our national meetings and our conferences, like we always do, to have opportunities for our alumni to come and meet with us and let us know what you're up to. But we plan to be reaching out more, both over certainly email and with our magazine, but we would like to host and a lovely thing with Zoom. Our love-hate relationship with Zoom these days allows us to have meetings with alumni and hear from them. We had a great time at homecoming this past fall, and to have more events like that where our alumni, both those close by and those are farther away, to really reach out and have some solid engagement with them. And we're excited to hear what they're doing. The alumni in both of our programs are really doing amazing things, and we're excited to have people get to know each other for that reason.
Yes.
And I
So
think
if they're getting emails from the College of Integrated Health Sciences, they need to
Open
know
them.
that open them. It includes social welfare, public health, and nursing.
and I think this provides us with an opportunity to make our connectedness to our alumni greater. And, there's opportunities to showcase them, to also invite them in to give talks, to join some of our classes, to speak with students about career paths. I think there are a lot of really great opportunities that exist there. And the one thing that Erin and I did not talk about is, our location.
Ah,
Right now, we're in two separate, we're on the East Campus, on the other side of the river, and on the downtown campus. But the goal is to bring us all together on the podium. So Erin, I don't know if you want to say a little bit more
sure.
about that.
So it's going to be a staged move in with different time frames. So the former School of Public Health, our four departments, and we're currently on the east side of the river in Rensselaer. We're actually moving this coming June to the podium to the old Earth Science and Math building. It is now called Pine Bush. It is in the process of being starting a renovation of that building, and we'll be moving in June. We will then have a 2-year process where the renovation will continue along with redesigning some of that space so that social welfare can join us in about 2 years. And in between those 2 years, we'll have special suites and hoteling, what we call hoteling space for our social welfare colleagues, just as we do for our DOH colleagues. And we're very excited. This will broaden opportunities for our students, for our undergraduate and graduate students to be together and to work with one another. What I'm very excited about in the first floor of that building is the Center for the Elimination of Minority Health Disparities, and the director of that center is a faculty member in the Department of Epidemiology, and so that center is there, and the Institute for Social and Health Equity is also in the first level of that building, just down the hallway. So we're very excited about the proximity to both of those groups, because so many of our faculty and students are already involved in that work, and certainly affiliates of both the center and the institute. So we're looking forward to being closer together over this time, and to be on the podium is a very exciting moment and opportunity for everyone, and everyone's looking forward to it. Although we are very busy trying to clean out lots and lots of files that we've accumulated over 25 years being in this building, but we're very excited for the move.
So
Well, this
if you've just tuned in, you're listening to WCDB Albany, and I'm Eric Hardiman, and I'm here with Alyssa Lotmore. This has been the Social Workers radio show, talk show, and podcast, and we've been talking with Vicki Rizzo and Erin Bell, both from the newly minted College of Integrated Health Sciences here at the University at Albany. Vicki and Erin, thanks so much for talking with us. We know this is a busy time for you right now with the new college and with getting everything rolling and dealing with all the challenges that are ahead, of course. And we appreciate you taking some time to talk with us today.
Thank
Thanks
you
for
for having
having
us.
us.